In today's Health Alert, the FDA's independent vaccine advisors have been discussing a new vaccine given in pregnancy to protect newborns from RSV. If approved, it'll be the first vaccine in the U.S. to protect infants from the contagious seasonal lung infection. Here with more details is our chief health editor, Dr. Partha Nandi. Dr. Nandi, the majority of cases of RSV are mild, so is there a need for a vaccine for infants?
That's a big question everybody's asking. Right, it's a very common childhood illness that most kids get before they turn 2 years of age. Now, RSV, Brian, is short for respiratory syncytial virus, and here in the U.S. we have around 34 million RSV infections. That's a lot in kids under 5 years of age. Unfortunately, roughly 10% of them end up in the ER. If the infections become severe, then pneumonia and bronchiolitis can develop, and those at greatest risk are infants. Now, this single-dose shot made by PFIZER was given to pregnant women in a clinical trial with nearly 7,400 participants. Protective antibodies that developed passed through the placenta to the developing infant. And what the trial found was this, that the vaccine lowered the risk of severe disease amongst infants in the first 3 months after birth by 82%. Big number. And by 6 months, the vaccine was 69% effective at preventing severe disease. It's also 51 to 57% effective at keeping the babies from needing to see a doctor due to moderate or severe infections. All good numbers.
All good numbers. We did just learn a few moments ago that the FDA advisors voted to support this new vaccine to protect newborns. What did this study tell us about preterm births and deaths?
Yeah, and this is what everyone wants to know, right? In clinical trials, Brian, you always have a group that gets the experimental drug and a group that does not get it. So here's a way to compare how effective a drug is, right? In Pfizer's RSV trial, there was a slightly higher number of preterm births in the group that received the experimental vaccine compared to the group that got the placebo shot. 5.7 compared to 4.7. It's not considered to be statistically significant, and that means just be due to chance. Now, what about deaths? It's important. There were 17 total in the main study. 5 of them were in the group that got the vaccine, and 12 were in the placebo group that did not get the vaccine. Now, of the 5 deaths in the vaccine group, the FDA agreed that 4 of them were likely not related to the vaccine. Now, the 5th death, however, the baby was born prematurely and 10 days after the mom received the vaccine. So there is a possibility that the death was connected to the vaccine. I know that sounds scary, but keep in mind there's no specific treatment for RSV. Here in the U.S., we have over 300 children under the age of 5 die every year due to RSV. So if the FDA's committee votes again in favor of the vaccine and the FDA approves it, then I think that this will actually save many newborn lives. And what happens is once it's out, you can get more real-time study to find out if that death is actually real. So we're not going to just say, well, it's all good. We're going to look at it even more.
And it's hard to say one death for the greater good of the 300 that die every year, too.
But every death is important, right? So we're going to look at it carefully for sure.
All right, Dr. Nandi, grateful as always.
My pleasure.
Thank you. And be sure to tune in this weekend to the Dr. Nandi Show. This week, he is talking about health heroes who inspire others to do more, including a patient who survived cancer 5 times and a fitness trainer who has a child replace Twinkies with push-ups at lunch. That's this Sunday at 1 p.m. right here on 7.
Wow, those are the results right there.
It shows.